Very good morning, guys. Very good morning. Today we will discuss something about typical depression. In this topic, we will discuss something about typical depression. It's general depression. It's a normal word, just typical depression. Okay, what is a typical depression? And how do you diagnose it? The ways how do you diagnose it, right? Diagnosis of depression. Diagnosis of depression, right? So we have a bunch of symptoms. In those bunch of symptoms, if 5 out of 9 symptoms prevail for, or if 5 out of 9 symptoms are present in the patient for more than or equal to 2 weeks, then you can confirm it as a depression. Okay, so in these 5 out of 9 symptoms, what are those things? Some of the symptoms are denoted as core symptoms, right? Don't get confused, no problem. See, there are total of 9 symptoms. See, okay, just leave this word. We don't want this word. We will just write those 9 symptoms. First one is reduced energy. Next, reduced mood. There is a decrease in the level of mood. Then decrease in interest. What is meant by decrease in interest called? Other term, can anyone? Anhedonia. Okay, there is a decreased interest. Okay, this is called anhedonia. Okay, now pathological guilt. Guilt. Okay, then fifth one, sleep problems, mostly insomnia means sleeplessness, somnambulism means sleepwalking, somnolence means hypersleep. Okay, and concentration issues, if you have any concentration oriented issues, unable to concentrate on a particular situation, concentration issues. Then if he has any reduced appetite, right, appetite. Then psychomotor changes, if you observe any psychomotor changes. I don't know why I cannot fit these things in one page, right? Always I get this problem, I don't know. And final symptom is suicidal thoughts, if he gets any suicidal thoughts. Now in this 1, 2, 3, 4, 5, 6, 7, 8, 9 symptoms, these 3 symptoms are called or can be denoted as core symptoms. The first 3 symptoms are called the 1, 2, 3. What are those symptoms? Reduced energy, reduced mood, and reduced interest. See, my writing is so curly, you might not understand. So reduced interest means, other term is called anhedonia. Okay, so these 3 symptoms are called core symptoms, and rest of the symptoms, they can be denoted as other symptoms. Okay, these are the other symptoms. In the total of these 9 symptoms, why we have divided these 3 symptoms as, why we have categorized these 3 symptoms as core symptoms? Because out of these 3, 2 should be present. 2 out of 3 should be present. You understand or not? You understand? See, total 9 symptoms. Listen carefully. Total 9 symptoms. Out of these 9 symptoms, 5 symptoms should persist for more than or equal to 2 weeks. Then you can confirm it as depression episode. In that 5 symptoms, 2 symptoms should be from these core symptoms, 2 symptoms out of these 3 symptoms should be present, then only you can call it as depression. 2 symptoms from this 3 of core symptoms, and the rest of the 6 symptoms should give at least 3 symptoms, then total 5 symptoms you will make, then it can be called as depression. You understand or not? 2 out of these 3 symptoms, core symptoms, 2 out of these 3 core symptoms plus 3 out of these 6 other symptoms. So total 5 symptoms out of these 9 symptoms should be present for more than 2 weeks or more than equal to 2 weeks, which can determine it as a depression. Okay. Now in the depression there are 3 main scenarios called hopelessness, which is mostly seen in the depression suffering patients. Hopelessness, helplessness, and worthlessness. These 3 conditions are generally seen in the depression patients, which are combinedly called Beck's cognitive triad. Remember this, very important MCQ. What is the Beck's cognitive triad of depression called? What do they consist of? First one is hopelessness, helplessness, and worthlessness. Hope, help, worth. Right? For example, I will tell you a mnemonic. If you are worth something, for example, if you are a Tendulkar, then you are worth something. You are worth of hundreds and hundreds of crores. You have 100 crore worth. So you can help someone. You can help someone. If you can help someone, then you can give hope to someone. Right? If you can help someone, then someone will have a hope like, yes, some big shot will help us in this tight situation. Some big shot will give us some food. So someone will have hope. Now if Sachin Tendulkar is worth 100 crores, he can help some poor people. So the poor people will have hope on Sachin Tendulkar. So that is called helplessness, hopelessness, and worthlessness. Then those poor people will be in depression. These 3 conditions together called Beck's cognitive triad. You got it? You got it or not? Yes. Now this is what is termed as a typical depression. But if you ask me, sir, you will explain typical depression, then there should be something called atypical depression. If there is typical, then there should be atypical. If there is typical seizures, then obviously there should be atypical seizures also should be there. So what is meant by atypical depression? Increased sleep. If the person has increased sleep. Previously in typical, what did we discuss? Patient will have insomnia, decreased sleep. But in atypical depression, patient will have increased sleep, increased carbohydrate craving, carbs craving, increased weight. This is important. I don't want to write with this color. This is important. The patient suffer from lead-in paralysis. In the next class, in the next coming classes, I will explain what is meant by lead-in paralysis, because it is very important topic for INICET. Very important topic. I will explain in the next class. Interpersonality sensitivity. One more thing is interpersonality sensitivity. Interpersonal sensitivity, not the interpersonal, sorry, interpersonal sensitivity. Then another condition we see is another feature. It is preserved reactivity. Preserved reactivity. Preserved reactivity, and I'll just change this color. Patient will respond, remember, patient will simply respond to MAO inhibitors. MAO inhibitor means anyone? Selegiline, rasagiline, these all are MAO inhibitors, right? And also SSRIs, MAO or SSRIs, selective serotonin reuptake inhibitors. And one more important thing is, this is one of the important statement, you just remember, there is a poor response to TCA. Remember this, there is a poor response to TCA, tricyclic antidepressants. Now these features are observed in patients suffering from atypical depression. Okay, and one more type is resistant depression, which we already discussed. What is resistant depression means? Something there is seen in 10 to 20% of patients who are already suffering from depression, and it is almost very like it's very hard to treat, and the treatment is combination of antidepressants. But while you are giving multiple antidepressants, always monitor for serotonin syndrome. Okay, now you can also give low dose antipsychotics in case of resistant depression, like you can also give lithium, thyroxine, and electroconvulsive therapy can also be given. So that is all about typical depression, atypical depression, resistant depression. All the three varieties of depressions were explained. Okay, so thank you.